All right, folks. So we're going to talk about something today because I am preparing for some stuff. And because I'm preparing, I have things on my mind and I want to talk and I want to ramble. So here we go. Are you ready? Let's get into it. For those of you that don't know me, I am Cherry Martinez and I am the founder of Cedar Surgical Services. And today we're going to talk about surgery, plastic surgery, the day before plastic surgery and the day of. What happens? What do we do? How do we prepare ourselves? How do we make sure that we minimize any problems and that we can get a smooth surgery day as possible? You tell me, So today I'm doing preparations for one of my girls that's having surgery tomorrow. Now, what happens? What do? You're not always going to have a me, right? So you need to get prepared. What happens the night before surgery? What happens the day before surgery? When should you stop eating? What should you be packing? What should you be taking with you? What are there, the things you need to know? All of that are the things I want to tell you today. So, first of all, if you're going to be having surgery tomorrow, the first thing that I want to tell you to do today is to eat, and to eat really, really good food, to eat good, to eat hard, to eat healthy, but to eat heavy. Make sure that whatever you eat is going to be enough to sustain you, because after anywhere from 8 o'clock at night to midnight, depending on your doctor's orders, you're going to be told to stop eating and stop all of your intake. So that means water, juice, food, anything that could potentially make you aspirate or make you have an internal type of a vomit situation during surgery, which will cause you to choke during surgery. Not good. They're going to make you stop, right? So that's the first thing. So if you're going to be having surgery tomorrow, you don't want to drink today, you want to stay away from alcohol, you want to stay away from anything that could be toxic to your body. You want to try your best to eat heavy because, like I said, after 8 o'clock or 10 o'clock, usually my girls stop eating around 10. But again, after a certain time, you're going to have to stop eating. And we don't know what time you're going to be going in the next day. We don't know what order of patient you're going to be in. For example, here in the Dominican Republic, the majority of my surgeons do 3 surgeries a day. And so how does that work? Typically, the girls are at the clinic anywhere between 5:30 and 6 in the morning. By the time they get through, their anesthesia prep and their admissions, and they get put into a room, and then they get brought into the operating room and everything else, it's easily 7:30 at the earliest before the surgery starts. So if you figure, a surgery can be anywhere between 3 to 4 hours, depending on the amount of procedures. If you're talking about lipo BBL, abmarcation, lipo BBL, breast lift, lipo BBL, arm lipo, chin lipo, all these different things, and we haven't even gotten into tummy tucks yet, right? So considering you have all these procedures that can take anywhere between 3 to 4 hours, if you go in at 7:30, that means that the next surgery is not starting till at least 11:30 or 12 in the afternoon. So you haven't eaten since the night before. It's already easily been 12 hours, 14 hours if it's noon, right? You're gonna be hungry. So make sure that you eat a nice amount before your cutoff time. That's the first thing, because I'm really big on food. I really hate to be uncomfortable. I get hangry and it's not cute. I'm cranky and I'm aware of it, things I gotta work on. But anyway, we're not talking about me. Second thing, you want to make sure that you pack. There's nothing more frustrating than going off to surgery and being at the clinic full of anxiety, full of your own nerves, your emotions, your excitement, everything that's going on, especially if you don't speak the language, right? Finding yourself here and putting yourself in a situation where you're going to be like, damn, okay, I'm missing this. I forgot that. Who's going to go get this for me? How can I go get it? Because now the ease of transportation, the ease of access, all those things are foreign to you. You want to make sure that you pack appropriately. Now, packing appropriately does not mean going to surgery with a suitcase. You do not need these items. You do not need these items. Now, this is a disclaimer because somebody will turn around and say that I said that they only needed, and hold on. This is a suggested list of the items that you should be bringing if you are going to be having the following procedures: lipo BBL, lipo tummy tuck BBL, any combination of a lipo abdominoplasty procedure, any type of arm lift, breast implant type of procedure. The following are items. Now, I'm not talking about nose jobs or facelifts necessarily. I'm not talking about calf implants and I'm talking about the majority of the procedures that those of us go to receive here in the Dominican Republic when it comes to plastic surgery. Or at least the majority of my patients, because that's what I'm speaking on, my level of experience, knowledge, and expertise. So, the things you should be bringing to surgery with you. 1, And this is the first thing, the very, 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 very first thing. So please make sure that you listen and that you don't go cheap on this item, because if you go cheap on it, I promise you, you're going to find yourself in a moment and you're going to remember me, you're going to remember this video. Listen to what I'm telling you, please. It doesn't benefit me. This is a free video. Do what I'm telling you because it will make your life easier. You need a blanket. That's the first thing. You need a blanket. And when I tell you a blanket, I don't mean like an airplane blanket. I don't mean like a little fleecy throw. You need a blanket. Why? One, when you go into surgery, everybody talks about that you come out and you come out cold, and you come out and you wake up and you're so cold. Do you understand why you're cold? Do you understand that you're in an operating room being sprayed with alcohol, being sprayed with wet substances to, sanitize and clean you up, in a room where you're butt naked and the AC is on blast? You've got to understand that it's been 3 hours of you freezing like that. You're just not aware of it because you're sleeping. So when you wake up, you're like, holy crap, because everything hits you at once. So yes, you need a blanket. Here in the Dominican Republic, for example, when you come to surgery, you have to come with your own nurse, and you have to come with your own supplies to some extent. Obviously not your own IVs and needles and gloves and things like that, but you want to come with your own blanket. You want to come with your phone charger. You want to come with baby wipes for yourself. You guys, I'm suffering from like the worst allergies, so please excuse my sniffles. You want to bring baby wipes, and you want to bring your own phone charger. You want to make sure, like I even sometimes send my girls with extension cords. You want to make sure that you have a boppy pillow. If you're doing any type of lipo, even if you're not increasing the size of your butt, but if you're going to be doing any type of fat transfer or any type of like defect improvements, like in your hips or in your back, or if you're doing any type of lipo in your back area, you definitely want to get a boppy pillow type booty pillow. Those are definitely available here. I don't make my girls travel with them. I tend to have them let me know they want one. I order it and I have them brought directly to the clinic for them, so they don't have to like lug around with this thing or leave it somewhere, because everything happens when you're getting ready for surgery. I swear, people like forget everything under the sun, All right, you guys, sorry. I had to take a break because I'm having like the worst sneeze attacks. I don't even know what's going on with my life right now. Hey, you guys, sorry. I had to come inside because my allergies were killing me out there. You see me? I'm like, I'm struggling. Anyway, so we'll talk more about surgery day in a few minutes. But before we get there, let's keep talking about the packing. So now that we've talked about packing a blanket, packing your phone charger, packing your ID, you want to make sure you pack some baby wipes. You want to make sure that you take whatever makes you comfortable. You don't need much. You need some slippers, some loose garment, or loose like a nightgown or something like that to wear. Sorry guys, I had to come inside. My allergies was like killing me. Anyway, so we'll talk more about surgery day in a minute, but let's talk again about packing. So now that you have your blanket and your ID, that you have your phone charger, that you have your baby wipes, make sure that you pack a pair of slippers. Make sure that you pack a light nightgown or a dress that you can pull over easily, or something with buttons preferably, so you don't have to lift your arms if you're doing any type of arm work. Just things to kind of consider. But yeah, you definitely want to make sure that you have those items. You don't need to take a lot of things to the clinic. Please don't do that. A huge mistake I see a lot of girls making is taking everything with them to the surgery center. It's not necessary. If you're going to be staying somewhere for recovery, you should have enough trust to be able to leave your stuff there. I mean, you're going to have them take care of your body, right? Why wouldn't you leave your things? So consider where you're staying, and if that's an issue, then that should be one of the first highlights and one of the red flags for you in terms of recovery. But that's just a side note. So pack light, take what's important, take whatever else your doctor suggests. I don't know if all your surgeons include compression socks or not. You may need to take compression socks. Now, the night before surgery, right? The night before surgery, you want to take a shower with Hippoclens soap. If you can access Hippoclens soap, one of the things that I would suggest for you to do, or that I suggest for all of my patients, is to take a bath with Hippoclens soap the night before surgery, as well as the morning of. So the night before surgery, you're just gonna hang out, you're gonna take it easy. Another thing, the best thing to do is, if you're going to have sex, to be only having light sex. Reason for it. A lot of times women, when they have sex the day of pre-op or the day of their surgery, tend to have blood that comes out in their urine. And we don't see it, it's microscopic, but those are enough levels to stop your procedure or to make them retest you or to delay you a day or two. These things happen. So just make sure that you're careful with your body, that you're understanding that you're going into a delicate procedure the following day, and that you want to make sure that, you're ready, you're rested, that spiritually, mentally, emotionally, you're ready for what your body's going to undergo. Because even though you're going to be sleeping for a large amount of the time, your body is definitely going to go through the ringer. Usually the next day's surgery is pretty easy. You're going to wake up in the morning, really early in the morning, you'll probably be hungry. You'll wake up in the morning, you will take a bath with the Hippoclens soap. After showering with the Hippoclens soap, you're going to be taken to the clinic where you're going to go for admission. You're going to do your check-in paperwork and you're going to be put in a room. And at that point, it's just going to be a waiting game. You'll be waiting for anesthesia to come by to set you up. You'll be waiting for your doctor to come by and check you out, go over any final comments, thoughts, doubts, whatever you want to discuss with him before. You'll get marked up, you'll get your pictures taken, and then you'll be wheeled on in. And at that point, we'll be waiting for you on the flat side. When you come out, if you're having surgery here in the Dominican Republic, you should have a private nurse waiting for you in your surgery room. Now, I prefer for it to be somebody who you've had the opportunity to meet and build some type of a relationship with, so that when you wake up to a familiar face. But that's just my service. I don't know how other people do it. But you'll have a private nurse who'll be there to tend to you while you're in the clinic, and you'll be usually spending the night in the clinic that day. So if you've had surgery, let's say on a Monday, you won't go home until Tuesday morning. Okay, while you're in the clinic, you'll be doing a lot of sleeping. You'll get a meal, like some tea at first. Then you'll get some type of a soup to try to put something in your stomach. You'll be receiving IV fluids and medications and things like that. Now, a side note, I don't know what procedure you're going to be having done. So depending on the procedure that you're going to be having done, if you're having a tummy tuck, lipo, BBL type of procedure, you more than likely will wake up in a faja when you come out of surgery. If you wake up in a faja out of surgery, or if you are told that you're going to be using a faja after surgery, please make sure that you bring a tank top with you to surgery, because you're going to need to put this tank top over your skin and under the faja when you finish. Because at the end of the day, you never want to wear your faja without a tank top underneath, at least not for like the first year, okay? So that's a rundown of what surgery day looks like, the night before surgery. If you have any questions, please make sure that you check in with me. I'm going to be doing a video shortly about what your first day home from surgery looks like, things to worry about, things to be concerned with. We're going to do a whole checkout on checkout from surgery, because I think it's really important. So many people check out of the clinic and forget to ask for so much information that's important, and then when you get home and you have issues like you're lightheaded, you're dizzy, this, that, the third, you don't know how to figure out if something's actually wrong or not, because you don't have the information you need. So we're definitely going to be educating you about how to make sure that your iron's in the right place, how to make sure that you leave the hospital at a safe hemoglobin rate, making sure that you know where you are, that you know what to look for, that you understand the warning signs, okay? So stay tuned. I'll be back.